St. Lucia's worst fear has become reality. On Sunday, March 29th, Chief Medical Officer Dr. Sharon Belmont-George reported the island's first local transmission of the deadly COVID-19. Evidence suggests that the senior citizen did not come into contact with anyone with the virus.
Case 5 is a 74-year-old female with no travel history or known contact with an individual with travel history. She presented at our facility on March 27th. Given that case 5 has no travel history or known contact with anyone with travel history, this confirmed case points to the existence of local transmission of COVID-19. Aggressive tracing of the contacts of these cases is currently underway by health teams dispatched to the communities of interest.
The Ezra Long Lab also recorded 4 other cases of the virus. One of the infected had traveled to the United States, currently the hardest hit country, with New York State as the epicenter.
Case 1 is a 24-year-old female with a travel history to New York. She was quarantined at home and presented at our health facility on March 27th. Case 2 is a 45-year-old female with a travel history to New York who presented at our healthcare facility on March 24th. Case 3 is a 47-year-old female with recent travel history to Barbados and Dominica. She presented at the healthcare facility on March 27th. Case 4 is a 36-year-old male with a travel history to Barbados.
Healthcare personnel will soon be armed with mobile phones to provide medical guidance, with the 311 hotline up and running.
The 311 hotline is available to provide general information on COVID-19 and access points of care. As of Monday, March 30th, this service shall be available 7 days a week and shall function from 7 a.m. to midnight daily. Also, 40 cell phones have been dispatched to our medical clinical teams. These numbers will be shared later this evening for persons requiring clinical advice from a physician.
Other recent cases were captured at the designated community respiratory clinics. People with flu-like symptoms can access care at these clinics.
The 5 existing respiratory clinics are the Grosole Polyclinic, Leclerc Wellness Centers, the Dennery Hospital, Viewfort Wellness Center, and the Soufrière Hospital. The services at the Dennery Hospital, Soufrière Hospital, Leclerc and Viewfort Wellness Centers are available daily from Monday to Friday from 8 a.m. to 4 a.m. The Grosole Polyclinic is available from 8 a.m. to 4 p.m., including weekends. Respiratory clinic services are available at the Victoria Hospital and the St. Jude Hospital and is to be utilized by persons with respiratory issues requiring care outside of the hours of the functioning of the clinics within the community.
Some 139 people have been tested for COVID-19 in St. Lucia. The island began testing at the local level on March 23, 2020, where 62 diagnostic tests were conducted. The Caribbean Public Health Agency CAFA also chipped with the rest. The agency remains on standby if needed. Gina Filippi, HTS News Force.